Now a portion of a news conference from the Centers for Disease Control in Atlanta, an update on the swine flu outbreak.
To start with the case update, this is on our website. There are 64 confirmed cases in the United States in 5 states, 45 in New York, 1 in Ohio, 2 in Kansas, 6 in Texas, and 10 in California. As I've been saying, numbers when it comes to an outbreak like this will change, and through the day you'll hear different numbers or newer numbers from states. We will continue to update our numbers once a day for consistency, but you will find with that some of our numbers may lag behind what you're hearing from a particular state. If you want information about cases in a particular state, the best place to turn for that information is to that state, because they're on the ground, they're the ones who are working to investigate and implement control measures. There have now been 5 hospitalized cases. As I've been saying, as we continue to look for cases, as this flu virus infects individuals, we will be seeing a broader spectrum of disease. What we see in the United States, or have been seeing so far, has been milder, has been less severe than what had been reported out of Mexico. And as we continue to look, we will continue to monitor that. So there were 5 hospitalized cases, 3 in California and 2 in Texas. The median age is 16 years with a range of 7 to 54 years. We expect to see more cases and we'll continue to report on those, but as we move forward, we may start to move away from specific case numbers and more onto describing states and clusters. The incubation period in the United States appears to be about 2 to 7 days, which is typical for what you see with an influenza virus. I want to take a moment and put this into context with seasonal flu. Many of you are well schooled in influenza and have been covering seasonal flu, but what we see with seasonal flu is that it can be unpredictable. On average, in the United States, each year from seasonal flu, we see approximately 36,000 deaths. And so influenza is a severe infection. It affects different people differently based on their own immunity, their ability to fight infection, and factors around the virus. Preventive measures, as we've been talking about, can help reduce spread and help protect individuals from getting the infection. Yesterday, I talked about the World Health Organization changing the phase from 3 to 4. And I talked about what that means. And from our perspective here in the United States, it has very little meaning. What we do means a lot more than what it is called. And what we're doing is being very aggressive, looking at what's going on at the community level, and adjusting and adapting our guidance and our actions based on what's taking place on the ground. Let me review some of the many actions that CDC is involved in around the country. We continue to work with state and local health departments. We have teams on the ground in Texas and in California. We continue to work with the World Health Organization, the Pan American Health Organization, Canada and Mexico. Yesterday we issued a travel advisory to Mexico that is recommending that non-essential travel to Mexico be postponed. For individuals who must travel to Mexico, we've posted guidance on things individuals can do to reduce their risk of infection while they are there. We've posted new treatment guidelines. These were developed in conjunction with the Infectious Diseases Society of America and the Advisory Committee on Immunization Practices. Those groups have provided us with excellent guidance for treating individuals who have swine flu. It's important to remember with the guidance documents, because there are a lot on the web. There's more than a dozen guidance documents that we've put up on the web, and we continue to generate more guidance. Guidance is interim. We change our guidance as we have more information, and we're going to continue to do so. That's very important. As we learn something, as it could impact on what public health is doing in the community or what individuals can do, we're going to change the guidance so that people have the most current information right away. We continue to deploy material from the Strategic National Stockpile, and I talked about this yesterday. It includes antiviral drugs. It includes gowns and masks and things that could be used in hospitals to take care of patients. And this is a forward-leaning step. There are certain states that have cases, and there are many. Most of the states have not yet reported cases. But every state has requested their portion of the Strategic National Stockpile, and we're in the process of delivering that. And why are we taking this action? Well, we're doing so because with any new infectious disease, with any emerging infection, you really can't predict the course.
This has been an update from the Centers for Disease Control in Atlanta, an update on the swine flu outbreak. You can see more on the Emeritus News homepage.